on what research is needed to advance multisectoral collaboration for health. And we're hoping that this will be an interactive session. And we're reflecting on work that was initially conducted for the Alliance for Health Policy and Systems Research with support from the Doris Duke Foundation. But the paper that the webinar draws upon was actually published in a BMJ Global Health supplement recently. And we'd also like to acknowledge the co-hosting by UHC 2030, which actually has a thematic working group working on multisectoral collaboration for health. I'm not sure that Nicole Valentine from UHC 2030 has been able to join, but she was very supportive of this. So we can move on to the next slide, please, Doug, if you're in control of these slides.
Yep.
My name is Sarah Bennett. I'm a professor and associate chair in the International Health Department at Johns Hopkins. And I really just wanted to welcome you to this session, provide a little bit of an overview of the session, and talk about the origins of this work before handing it over to our speaker and panelists. Next slide, please. So as Jeff was saying, we would be grateful if you could keep your microphones on mute. You can type questions into the chat box. There should be a sort of bubble-like symbol at the bottom of your page, or it could be on the right-hand side where it says chat. Please send them to everyone so that everyone can see the conversation. Also, feel free to tweet if you're a tweeter. And we've listed some of the relevant organizational entities which are supporting this in case you want to tag them and hopefully get your tweet picked up by more people. Next slide, please, Doug. So I'm going to give actually probably a less than 10-minute overview of the call for research from the Alliance. And I'll then hand over to my colleague, Doug Glandon, who will provide a short presentation giving you an overview of the exercise that we undertook to identify and prioritize research questions on multisectoral collaboration for health. Doug is currently a fourth-year PhD student here in the Health Systems program at Johns Hopkins and has worked in a variety of roles in health systems policy and practice at various times as a researcher, an embedded advisor, and provider of technical assistance. Largely in sub-Saharan Africa, but also in Latin America and the Caribbean, South Asia, and Asia Pacific. Immediately before joining the PhD program, Doug spent 3 years with the Fiji Ministry of Health as an advisor for strategic planning, M&E, and research. His dissertation is actually focusing on this topic about multisectoral collaboration, and in particular is trying to develop, test, and validate a quantitative metric to measure collaboration between frontline workers in rural Uttar Pradesh, India. So after Doug has provided the overview of the exercise in the paper, we are going to then invite 2 policymaker responses and reflections, and we've invited Dr. Charles Mwansambo from Malawi and Dr. Wallaiporn Pacharanarumal from Thailand to really help situate this work in particular local contexts. And we've asked them to reflect a little bit on what the needs are in their particular contexts. Just to give you a brief introduction to our 2 policymaker respondents, Dr. Charles Mwansambo is a UK-trained paediatrician and is a fellow of the Royal College of Paediatrics and Child Health. He's currently the Chief of Health Services for Malawi. And prior to his current post, he was Secretary for Health, and before that was a consultant paediatrician and head of department at the Kamuzu Central Hospital in Malawi's capital city, Lilongwe. Charles has also served as hospital director at the same institution in the late 90s and early 2000s, and his research interests really focus in the domain of maternal, newborn, and child health. Then we're also delighted that Wallaiporn is able to join us. Wallaiporn earned a BSc in pharmacy from Khon Kaen University, Thailand, an MSc in Health Development from Chulalongkorn University, as well as an MSc in Social Protection Financing from Maastricht in the Netherlands. Her PhD is in Public Health and Policy at the London School of Hygiene and Tropical Medicine, and she has been a researcher in healthcare financing at the International Health Policy Programme Thailand since 2001. She is now the director of IHPP and acting director of the Global Health Division, Ministry of Public Health, Thailand. So we very much look forward to their reflections. I'm keeping my fingers crossed that we've managed to connect Wellaiporn's mic at that point. So, after we've heard from our panelists, we will then open it up to discussion, including your comments and questions. So if we can go on to the next slide, I wanted to just reflect briefly on where this research came from and why the Alliance decided to commission it. The Alliance for Health Policy and Systems Research has actually had a history of conducting these kind of studies seeking to identify priority research questions in different domains. So I think during the mid-2000s, they conducted work around human resources for health, financing for health, and the role of the private sector. But with the launch of the Sustainable Development Goals, I think there was a sense that the parameters of the research agenda were shifting, and that it would be good to reflect on what are the implications of the SDGs for health policy and systems research. And as this slide suggests, I think the SDGs reflect in particular the interconnectedness of our social, environmental, and biological systems. And there's actually some interesting papers that have sought to map different elements of the SDGs, so to demonstrate the interconnectedness across different goals. And if you look at the health goals, they're very closely interwoven with goals around our urban environment, around the physical environment and pollution. So this issue about multisectoral challenges is central to them. Accordingly, we felt that new health policy and systems research priorities were required to guide generation of knowledge to achieve the SDGs. So the aim of this overall process is really to catalyze investment in intersectoral and multidisciplinary research, to facilitate dialogue between policymakers and researchers, and to develop innovative processes to support identification of health policy and systems research priorities. So I should perhaps also say that as part of this work, we looked at 3 different research domains which we thought were particularly relevant to the SDGs. This one around multisectoral action for health was one of them. The other 2 areas were around social accountability, which Kerry Scott led, and we did a webinar on that earlier this year. And then there's one further topic, which is around social protection for health, and we'll be doing a webinar on that topic exactly a week from today if you're interested. Next slide. So that should give you just a little bit of background around the overall purpose of this piece of work and what we were seeking to do here. I'm now going to hand over to Doug, and if you can advance the slides, Doug. I'd like to hand over to Doug, who'll give you an overview of the research questions that we came up with and the process through which we developed them. So Doug, over to you.
Thank you very much, Sarah. During the next 15 minutes, 10 to 15 minutes, I will be talking about the findings, or the process and the findings from this paper, recently published just last month in a special supplement in the BMJ Global Health Sorry, I'm getting a little bit of echo there. All right, hopefully that's going to work a little bit better. The paper was published in a supplement on governance for multisectoral action for health. It's an open access article. The title of the paper is Identifying Health Policy and Systems Research Priorities on Multisectoral Collaboration for Health in Low-Income and Middle-Income Countries. And just by way of background, this topic of multisectoral collaboration has been discussed in sort of the historical antecedents of the field of global health for about 100 years, possibly longer. And so you might think that we actually have developed a lot of clear conceptual frameworks and a set of methods associated with studying multisectoral collaboration. but that's not actually what you find if you look around in the literature and try to identify papers that will give some clear guidance. So we recognize that for this paper, the current context with the emphasis on universal health coverage and sustainable development goals has created an opportunity to look again once more at multisectoral collaboration, and has generated a lot of buzz. And so people are asking a lot about, what do we actually do? And this is coming from the research world as well as from policymakers, saying that, yes, we believe that this is important. We know that we have to somehow collaborate across sectors to achieve Sustainable Development Goals, UHC, but what does that actually mean in practice? So this paper is basically a summary of some of the current questions from the literature around multisectoral collaboration, as well as some key questions from policymakers around the world related to their evidence needs or research questions that they have, questions they want answered in order to make policy or implement policy related to multisectoral collaboration. The paper had 3 phases. The first phase was looking into reviews of articles on multisectoral collaboration. The second phase was focusing on these conversations, in-depth interviews, focus groups with policymakers around the world to ask them for their views. And the third phase basically took the key questions that were coming out of phase 1 and phase 2 and then put them available or made them available in an online platform for voting. And a variety of health systems researchers were invited to come and look at those questions and then vote on them to indicate their perception of the priority today for those questions. So each of the 3 phases actually produces its own set of kind of top-ranked research questions, and we'll look into each of those. For the first phase, we focused on review articles rather than going into the thousands of independent articles that were looking at multisectoral collaboration in one form or another. We ended up reviewing 38 articles. Largely they were literature reviews, but there were a variety of other types of reviews as well. And the themes that they focused on were mostly kind of a cross-cutting theme saying, okay, we want to understand multisectoral collaboration conceptually, and let's look into all of the articles that kind of are relevant, within our search parameters. But there were also some articles that focused on a specific topical area, like social determinants of health, or food and nutrition, or health and social services, and they sort of approached multisectoral collaboration from that context. So from the overview of reviews, I've listed here the most commonly identified research questions, just sort of in short form, as well as the number of different review articles that actually mentioned that type of research need or question. And when we created the questions, we had to sort of paraphrase them to avoid having hundreds of questions. But basically, the first one is asking about which types of study designs and methods are most effective for understanding multisectoral collaborations. I'm just going to show that question specifically here. So you can see the full form of the questions. Which study designs and methods are best suited to understanding multisectoral collaborations, their governance, functioning, and outcomes? So you see there were 18 articles there. And then we see the second one focused on leadership and governance structures and processes. That was a really big one that came up. And then you can see the remainder of the list there. And I won't go through all of these, but we will have time to come back if you want to look at the specific questions. I wanted to point out also that if you look on the sort of right-hand side of the screen, the pie chart, you can see that the majority of the review articles focusing on multisectoral collaboration came from high-income countries. Now, going into phase 2, like I mentioned, we had in-depth interviews and focus groups with senior policymakers, government officials, and leaders from bilateral and multilateral organizations around the world. There were 85 people invited to participate in in-depth interviews. 54 participated, and then we had 2 focus groups, and 27 of 33 invited people participated. There was wide representation from around the world. The only region that was not represented was the European region, and that was primarily because we were focusing on low and middle income countries for this paper. So looking below at the most commonly identified research questions, the first one was asking about what are the governance structures and processes, which ones were most effective for multisectoral collaboration. The second one asked about strategies and mechanisms for implementation. So again, how do we structure these collaborations, and what do we actually do to implement these collaborations? And just by way of reference, both of these ranked very highly in the in phase 1 as well. Just if you look at the right, you can see the gender breakdown of our respondents. It was predominantly male, but I've noted that it roughly represents the kind of global distribution of gender in among senior policymakers around the world. So the third phase was taking these key questions from the reviews and from the policymakers. When we paraphrase, we try as much as possible to keep the kind of the spirit and intent and meaning of the question intact. And then we made those questions available online for the health systems researchers to review. They, in a first phase, proposed edits to those questions. So each person would propose an edit, and everyone else participating would have the opportunity to accept the edit or propose a different edit. Basically, to just try to tweak the wording of the questions. There were not substantial changes from that process. And then after that, all of the participants had an opportunity to vote on the questions or compare them. And the way that that was done through this online platform called CoDigital is that each of the questions appeared side by side with one of the other questions at a time. So each person would see 2 questions, and then they would indicate which of those 2 questions they felt was the higher priority. And then they would be shown a series of another 2 questions, and they would do the same thing, and so forth, I think 25, 30 times. And in each instance, we were asking the participants to make their choice based on 3 prioritization criteria. The first was what would be the sort of potential benefit or impact from these questions. So which one would have a higher potential benefit or impact? The second was the tractability or feasibility of the question. Is this something that we can actually answer in a reasonable time frame or with a reasonable amount of money? And then the third one is focusing specifically on what would the benefit be to poor and marginalized or marginalized populations. So if you look down at the bottom of the slide, you can see the ranking of the questions, and the percentages represent the percent of time that this question won out over another question that it was compared to. And you can see that although we did end up with a ranking, there's actually not that much of a difference in the spread between, say, the number 1 on top there and the 10th one on the bottom. 67.9% of the time, the question asking about, what are the most effective strategies and mechanisms won. as compared to the one on the bottom, effects of multisectoral collaborations on health equity and social determinants. That one still won half of the time, or was sort of ranked more highly half of the time. So it sort of indicates that there was no clear set of questions from this process that stood out and were kind of clearly of higher priority than other questions. And also to point out, of the remaining 20 questions in our list of 30, there was sort of a gradual trail off in terms of the percentage of times that they won. And that's all available in the paper. This slide just summarizes the types of questions that were appearing in the global ranking on top in the blue circle, from the reviews in the green circle, and from the policymakers in the yellow circle. And in the middle, in the very middle, you can see that all three of those sources prioritize questions about what types of strategies and mechanisms are useful or most effective in multisectoral collaborations, or to make them work, and also what types of leadership and governance structures are most effective for multisectoral collaborations. I also wanted to point out that there is, in between the green and the blue circle specifically, there is a little bit more of a research focus. I mean, there's this focus on what types of study designs and methods are most useful, what are the differences in use of evidence across sectors. So there was definitely more of a research focus there, I mean, because those obviously are researchers commenting there. But I want to contrast that to what's just in the yellow circle alone. So these are the things that were mentioned by policymakers, but were not highly ranked in the review, or did not appear commonly in the reviews, and were not particularly highly ranked from the online voting. So questions about how do you increase the partner commitment in a multisectoral collaboration, or how do you identify the appropriate boundaries and scope? Who should be included or excluded? What are the differences in multisectoral collaboration at a local level versus a national level? A little bit below, what's the role of different ministries in doing this? Multisectoral collaboration spans sectors, and it might not necessarily be the case that the Ministry of Health needs to be in the lead in all cases. So I wanted to highlight that difference. And just to summarize some of the key takeaways from the paper, the interest in multisectoral collaborations came from a wide variety of disciplines and topical domains. It seemed that a lot of different people interested in a broad area like active communities or NCDs or zoonotic disease found themselves also interested in multisectoral collaboration because of the nature of those issues. As I mentioned earlier, most research to date on multisectoral collaborations has come from high-income countries, and many fundamental questions about multisectoral collaboration remain unanswered, as evidenced by those questions that kind of rose to the top. Also, there's a strong demand for practical evidence-based guidance. A lot of the wording of those questions was around, what do we actually do? How do we structure this? How do we implement this? How do we measure this? How do we sustain this? And then finally, researchers also want to know how best to study multisectoral collaborations. So there may be a possibility that some kind of foundational methodological work is needed before some of the other more pragmatic sort of practice-oriented questions may be answered. That's it, and I will hand it back over to Sarah.
Thank you very much indeed, Doug, for giving us that overview. I think that we should go straight on to our policymaker discussions, and I'd like to invite Dr. Charles Mwansambo to kick that off for us with your reflections on this piece of work, but perhaps more importantly, how you see the priorities for research on multisectoral collaboration in Malawi. Over to you, Charles.
Thank you very much, Doug and Sarah, for that introduction. I need to commend the team for this very wonderful paper and well presented too. We all agree that if we're to achieve the 2030 agenda and the SDGs, obviously we need to work beyond the health sector. And this work that you did just demonstrates that. And there's obviously a need to do a lot more. I would take you straight to our own example in Malawi. In fact, I'm not in Malawi at present. I'm in Zambia. And on a positive note, I mean, it's actually a multisectoral collaboration meeting I'm attending. It's on the TB, regional TB program. So obviously, people have realized that we need to move forward, and as a sector, we can't do it alone. We need to work with other sectors, and the health sector should not always take the lead. I mean, it can be another ministry doing it, just as the paper demonstrated. The first I propose, I know you did mention this in your presentation, but I feel that from a policymaker's point of view, the first activity for each country is to map out a mapping exercise to see what multisectoral collaborations have gone in, and to also look at the gaps in order that we understand what's happening in country. I know a number of countries may have done that already, but for Malawi, I think we need to do that. And what I've also noticed is that there are some collaborations that have worked well and others haven't. But that's just a personal observation. And where you all have a common goal, things usually go remarkably well. So that's something that worth looking at. I'll give an example of Malawi again. I mean, we've been working hard to fight the harmful effects of alcohol, and a number of players were brought around the table. Us from the ministry, from Home Affairs, the police, the judiciary, but also brought in the alcohol industry. And obviously, the alcohol industry were interested more in the profits, while government was interested on the other side. So that didn't exactly work the way we wanted it, but finally, we came up with an alcohol policy. But obviously, it wasn't that easy to come up with that policy. The other one, which most of you are familiar with, is the Framework Convention for Tobacco Control. We have two sides. The policy side that want to protect people against the harmful effects of tobacco, while as, of course, there's also the economic side of things. So for those multisectoral works, I mean, it may not be as easy. But there's one positive one that we actually having at present, which is looking at the emergency medical services, looking at the road traffic accidents and working with the people in road safety, the police, and the ones that construct the roads. So the number of questions though that we need answers for. I mean, I hope when I get a chance, we also look at what has made, in addition to what I say, there might be other issues that will drive or end up with positive multisectoral collaborations, while some end up not succeeding. But on the overall, I mean, the paper is wonderfully written, and I'll pause there for now, and is happy to take any questions that come.
Thank you very much, Charles, for those thoughtful reflections. And I was particularly interested to hear your reflections about how challenges differ according to whether the interests of the different partners are fully aligned, maybe overlapping but not fully aligned or really conflicting. And I think your alcohol example gives a good example of sort of conflicting interests and the challenges that can create. And I know that Wellbeing has thought about that a little bit in a totally different context around asbestos, but maybe I can hand over to you, Wellbeing, to reflect a little bit more on what you think the research priorities are in this area, particularly based upon your experience in Thailand. If you unmute yourself, Wellbeing.
Yeah. Thank you, Sarah. Thank you, Douglas, for the presentation. For the presentation, I would like to add one more thing, rather than social determinants of health. As heard from Charles already, that we need to deal with the commercial determinants of health as well. And then social and commercial determinants of health are very important. For the actors that Sarah mentioned about the asbestos, that we really involve with the private company. That is another key actors in the area of multisectoral collaboration that we need to have. I would like to add more on other three actors. The first actor is on local government authority, that we need to work with them and need to have the good collaboration with them in order to work closely with the community context. Another actor is a citizen, and in Thailand we try to build up capacity of a citizen to be an active citizen, to involve with their communities and to protect and contribute to their communities. Another one is on private provider. In Thailand, we have lots of public health facility as well as a private health facility as well, like a pharmaceutical private pharmacy or private clinics and private hospital. At this moment, we utilize them, but still we lack of regulatory capacity to do good things. For example, price control, price setting and price control of private clinic and private hospital. That is also another area of collaboration. That is on the actors. For the characteristic of the actors, I would like to propose one thing, that we need to change the paradigm of thinking. Normally in Thailand we have the policymaker who are familiar with command and control process, but we need to build up also the communication and collaboration leadership within health sector and other sectors beyond health. So this kind of thing could be around the issue for multisectoral collaboration. I fully agree with Charles for the alcohol and tobacco, which are the risk factor for the NCD. I would like to add one thing more on trade. That is become important, mainly involved with the trade and health issue, especially on pharmaceutical company, as well as the food security and food safety in the country at this moment. Maybe I stop for now, and maybe if you have anything to ask or to seek further clarification, I could add more. Over to you.
Excellent. Thank you very much indeed, Wellbeing, for sort of alerting us to some of these other dimensions. I think firstly, you talk quite a lot about the fact that when we're talking about multisectoral collaboration, we need to acknowledge it's not just across functional sectors like education, health, industry, but there tend to be multiple different actors involved, such as local government, citizens, and the private sector. And I think, when we started working in this area, we struggled with this notion about because multisectoral collaboration is often used to also refer to collaboration between public and private actors. And I think actually we need to think about all of these dimensions together across different kind of functional sectors, but also across sort of different public and private type of sectors. And then you also alluded briefly to the sort of challenges of building more collaborative approaches to leadership and sort of the kind of skill sets that are needed, as well as this particular issue around trade and health. So I think that those were really good prompts for further discussion, and I can see that we've got some really interesting questions already coming in from some of our participants. So Jagno sort of raising this question about, sorry, my screen flipped as I was trying to reflect on it. From a policymaker's perspective, what are the strategic considerations in getting other ministries committed? And maybe what I'll do is highlight some of these questions and then return to the panel for your reflections on these, if I may. So I think that that's a really good question. We often say, you know, I often hear people in the health sector complaining that other sectors are not adequately involved without perhaps really reflecting on why is that the case and what's there, how can we motivate them to become more involved. And then Helen Schneider has reflected from a slightly different perspective about sort of how bureaucracies function, and their essence is often around these sort of very hierarchical approaches, as Helen describes here. And to what extent does research or strategy really recognize this and address that? I have some thoughts on that myself, but I'd be really interested to hear the panel's responses. And then Ida has added to Jagnor's question about what about researchers based in other disciplines, e.g. the field of education? How do we as primarily health-based researchers recognize and engage with researchers in other sectors? Really, really interesting and important one. So maybe any preferences about order? Maybe I could start with Wellaiporn and then go to Charles and then Doug. Is that okay? I know that I'm throwing you into the thick of it, but Wellaiporn, you don't need to respond to all of those, but if you have some reflections on those questions, and then we'll come back to the other questions below.
Thank you, Sarah. I would like to respond on the motivation for the collaboration. I refer back to the concept by Dr. Pravet Wasi, the senior person in Thailand, who introduced triangles that move the mountain. You might know about this, but for those who has not yet hear about this, I will explain a bit on the three angles. The first angle is on knowledge. The second angle is on political will or political support. The third angle is on social mobilization. We believe that in Thailand, for example, for the UHC reform, we apply the concept of a triangle that moves the mountain. We build up our knowledge on health insurance, health financing, etc., related to UHC, with the support of society that they agree on equity in health services, and then they support on drafting bill to submit to the cabinet. And then the political opportunity comes in during the general election. With these three angles, we could move towards universal health coverage. So I would like to explain that we have the motivation to one goal of the society, which is equitable access to health services for all. And then when we mean mainly the majority of the people in the society share one vision, one goal together, and then we could seek support for this goal, and we move along the line with that goal. So for the multisectoral collaboration, the basic question is that do we have a shared vision to go together? For example, the alcohol policy is quite contentious to discuss because we still have a different perspective. One is to protect health of people. Another one is might think about the profit of the company. Then we need to find a common standpoint where the society will go on. And then we combine all the opportunity of having knowledge, social support, and the political will to support that movement. I would stop at this moment and turn the floor to you, Sarah.
Thank you, Walaporn. So I think you were really addressing, I think, Jagnul's question about how do we try and incentivize policymakers in other sectors to engage on health issues. Charles, maybe I can come to you and see if you have any further reflections on that, or alternatively.
Yes, no, I can come in.
Please go ahead.
I think the main issue is, of course, to identify core benefits, so win-win situations. And of course, you did talk earlier about motivating factors. I mean, one thing I tell colleagues when I'm trying to work with them is to say that a healthy nation is a wealthy nation. It is actually easier for most of my colleagues in the other sectors to achieve their policy goals with healthy people, because we know that healthy people are productive and better contribute to social and economic development. So that's just a starting point. But of course, being in the health sector, we are unfortunately the inheritors of failures in the other sectors. So we need to make sure we engage other sectors as well. But this, I mean, I'll give you an example of water and sanitation issue that we have once in a while in our part of the world. I mean, in this time of the year when we have rains, at times when we have cholera, and we know that cholera is a hygiene issue. If you have plenty flowing water, plenty clean water, people use latrines. I mean, cholera should not be an issue. But because of failures in the water department or other sectors, then obviously all those problems end up with the health sector. So we have to engage them and see how best we can work together by telling them that, well, look here, if people are sick, then obviously they can't come work for you and you can't be productive. So that's where I would look at it now. Thank you.
Thank you very much, Charles. And maybe, Doug, I can come on to you, and perhaps you can tackle some of these other questions that were raised, like Ida's about engaging researchers in other sectors, and Helen's around sort of bureaucratic forms.
Sure. So I just wanted to comment briefly first on the sort of research perspective on the first question about, what are the strategic considerations in getting other sectors committed? That very question came up. It wasn't one of the top-ranked questions, but it came up quite a bit in our Policymaker and review questions. There were questions about, what's the impact of achieving health outcomes or delivery of health services on the achievement of other sustainable development goals. And what was embedded within the papers and conversations that raised that was this very question, trying to get away from the idea that health sector should reach out to other sectors, pitching the message that you should also care about health, and instead think about, okay, here's what health can offer you. And to be able to have some concrete evidence to support that statement, so that it actually is more compelling. So there's definitely interest in developing the evidence to make that argument in a compelling way that came out of the papers that we reviewed, and that will probably continue to grow. Another thing is that there are some papers and some research that looks into both theoretical and empirical questions about the process of achieving that shared vision that Walleyporn mentioned. What does it actually take to get there? And this goes into a literature into like public administration, and organizational development and organizational theory, where these questions have been asked for years, for several decades. There's quite a bit of work that's been done. A lot of that work is not directly relevant, or it might be relevant, but it comes from high-income countries. So you have to ask the question about how appropriate will it be in low-income or middle-income contexts. But there is a fair bit of work that's being done outside of the health sector on those kinds of questions of how to achieve shared vision, theoretical frameworks, and also case studies in a variety of ways. So there's a lot that's out there. With respect to Ida's question about how do you engage with researchers in other disciplines to focus on this, I suppose there could be a variety of ways. But one example of something that we were trying to do in this supplement is incorporate a perspective outside of the traditional health perspective. So one of the authors in the supplement is actually somebody who does research in public administration. Actually, an author who focuses on, Kirk Emerson, who focuses on the kind of the theoretical framework of collaborative governance. And she talks about that and reflects on what that might mean for health, even though that's not the area that she's necessarily focused on. So I think identifying potential co-authors to work on papers would be one. I would say maybe trying to reach out to other researchers who have written articles outside of the health sector, but maybe doing something that looks similar to what you may be doing if you're a researcher. Probably there's quite a bit more work that could be done in terms of conferences and forums for researchers to engage. I mean, there's still a lot of sector specificity for these types of conferences. So I don't think there's an easy answer about how to define the scope so that you still have some sort of conceptual focus, but allow people to meet researchers with another discipline. But I mean, maybe having a conference specifically focused around multisectoral action or multisectoral collaboration could be useful in that respect to get some exchange going. And then I think, Sarah, for that last question related to bureaucracy functioning, I didn't quite get the question, and I'm actually not able to see the questions on my screen. So maybe if you could either repeat it.
Well, we've also got a lot more questions coming in.
Oh, okay.
Maybe, I don't know if you click on the chat, whether you may be able to see them. But I had wanted, if I may, to use my moderator's prerogative to respond very briefly to your question, Helen, because my sense is that you're absolutely right that there's a big literature that talks about bureaucracies and how they're hierarchical, specialized. And I think that in the past 15 or so years in high-income countries, there's been a lot of organizational innovation to try and better enable bureaucracies to work in a more horizontal and joined-up way, the whole sort of joined-up government kind of approaches. But I don't think that we have seen the same experimentation going on in low and middle-income countries. And I think it would be great to see more of that. So there's a number of research-oriented questions, Doug, that have come in. So I think some of them are interested in the breakdown of the reviews that we looked at. So Jeff is asking, it was interesting that only 6 out of 38 of the reviews were focused on low and middle income countries. Essentially, why is that the case? And also another comment from Anne Wilson about that, asking really about the split in terms of the reviews. Well, there are a lot that were really looking at NCDs versus communicable, and how does that compare to communicable diseases? And then other questions. So Anne is asking about what do we see as the sort of appropriate structures to support multisectoral collaboration? Are there particular sort of committee arrangements that would be important to reflect on? And Nukba's asked the great question about a common language for communication and dissemination. So essentially saying it's all well and good to say we need to collaborate in research across sectors, but how do we communicate our research in ways that's relevant to different sectors, which was actually sort of one of the research questions that came out. I think Marcella, building on that, is sort of asking the question about, do we need to be able to share the same methodologies and approaches across sectors? Joanna's sort of picking up again on this theme about what have been some successful structures or approaches for engaging community perspectives in the policy-making level. And then I'm going to pause after this next one because there's still more questions. Inam has asked, specifically to you, Walaiporn, what are the challenges that Thailand has faced implementing some of the multisectoral collaborative projects? And if I can ask our panelists to keep their responses fairly brief, because I know that there's still more questions out there. Maybe we can ask you to go in an opposite order this time round. I don't know if that would be fair, but Doug, we'll start with you, and maybe you can tackle some of these research questions or questions about the process of research first.
Sure, yeah. So related to the question of the breakdown of reviews, why we're so few focused on low and middle income countries, my best guess is that that's actually just the reflection of the research. I mean, there have been, there's a longer history of focusing specifically on these types of issues in high-income countries. There was, like, the bulk of the literature was coming from Europe, UK, Australia, Canada, and the US. That was like a huge chunk, particularly when you're finding review articles where they're directly focusing on the question of multisectoral collaboration. What is it? How do we do it? How do we think about different types of governance structures? And that's an important, actually, methodological decision that we made in the paper. We found that there were a larger number of articles that focused on a different topic and that mentioned multisectoral collaboration at some point, but really were not directly focused on that. And the typical way that would come out is a paper would be focused on, say, NCDs or something like that, and say, these are the issues with NCDs in this region or this country. These are the efforts that are being undertaken. This is what still needs to be done. And in the discussion section, there would be some mention of, okay, and by the way, multisectoral collaboration is needed, or something like that. And so it was only kind of peripherally mentioned. It was identified as important, but there wasn't really, the focus of the paper was not to get into that. So I think that's sort of the first question, is just the focus on this research, multisectoral collaboration research is just more common in a high-income country context at this point. That needs to change. I think we need more from low and middle-income countries. Related to the question about a common language for talking about this, absolutely. I think one of the things that we found also is that people talked about this in many different ways, and so it was sometimes hard to even find which articles should be included. I mean, it has implications for your search terms if you're trying to find all the relevant articles. And it relates to the comment that Sarah made as well about how people often don't define what they mean by multisectoral collaboration or intersectoral action when referring to it. It's just they say it and then move on and talk about the implications of it. And I think that in this stage where people are sort of talking crossways, and some people are talking about, okay, I'm talking about collaboration between health and education and agriculture and criminal justice, and other people are talking about public-private partnerships, it's very important for people to define what they actually mean before going forward, and hopefully that will help get toward or move toward a common language. And I think relatedly, that would help with identifying common methodologies and approaches. If you understand specifically how someone's phrasing or framing their research question on this topic and understand the conceptual framework, that would be very helpful. There are several theoretical frameworks that have been identified and that people have used to frame their research questions on multisectoral collaboration, but the majority of papers did not have any conceptual framework. And so I think that actually could be useful for people to provide a conceptual framework in research papers to help the readers understand why they thought about it in that particular way. I think I'll just stop there, but we can come back to more questions later.
Great, thank you very much, Doug. So maybe I can come to you, Charles, and in particular some of these questions about what do we know, and do we have any thoughts about ideal forms of sort of committee structures, bureaucratic mechanisms that can facilitate multisectoral collaboration? I don't know if you have any responses on that point.
Yeah, I'll give an example of Malawi. We have some governance structures already in place in the form of technical working groups, but there's also a health sector working group which takes care of both government and a number of non-state actors. So we can look at using the same sort of structures, except in occasional situations where you may have to go beyond. I mean, recently we've just had what is called an antibiotic, antimicrobial resistance awareness week, and this is, we know that it's not just the health sector that's involved with that. There's also Minister of Agriculture that also is directly responsible with the use of antibiotics both in the soil and on animals. So there are already interministerial meetings that look at other issues. So it's a question of jumping on the same to investigate whatever issue comes up. I've seen a question dealing with vectors here, and for Malawi we have an issue with 2 areas in the country in the national parks where there's sleeping sickness, and we know that alone as a sector we cannot control the excesses, but if we work with our colleagues in environment, our colleagues in agriculture, we can achieve better. In fact, there used to be a time when the collaboration was extending beyond our borders to involve Mozambique and Zambia and Zimbabwe, but when that died down, the flies came back. So obviously you need to work as a team to make sure that you're more effective. And just to say that where possible, work with already existing structures. So you can have interministerial committees, but along with non-state actors, and those committees can be at PS, principal secretary level, and you can also have technical committees that do the same. Otherwise, we end up with so many committees dealing with the same. What other question was there? On I think I'll stop there for now. I think I've misplaced my other little piece where I put my notes on the other questions. So I think I'll come back when I find it.
Okay. Thank you very much indeed, Charles, and do let us know if you have more to add. I had wanted to actually follow up on this question about organizational structures. I mean, my sense is that we don't really know what are appropriate organizational structures for facilitating multisectoral collaboration. But I know that there's been quite a lot of experimentation, again, in high-income countries with initiatives such as policymakers, so having someone very senior, but not associated with any particular ministry, but having oversight over a multisectoral issue such as obesity, for example. So he or she, the policymaker for obesity, then gets to influence policy in all ministries on policies which are relevant to that topic of obesity. And I think one of the other sort of innovative initiatives in this space is joint budgets. So where you have budgets held back from ministries, but they're focused on addressing a very particular multisectoral issue. And I'm not aware of either experimentation or evaluation of these kind of approaches in low and middle income countries. But if anyone else is, I would be really intrigued to hear about it. So Wellbeing, I know there was.
I can comment on that one.
Yeah.
Where you have an issue involving more than one ministry. I mean, we have an example of family planning being not just a health issue, but a developmental issue, in which case we have involved the Ministry of Economic Planning and Development. So same applies to obesity. We shouldn't look at obesity as a health work issue alone. It involves issues around nutrition, it involves agriculture, and so on and so forth. So where there is an issue involving more than one ministry, in Malawi, generally that's handled by a department called EP&D, Economic Planning and Development. And that has worked very well over the years. Thank you.
Thank you very much, Charles. So last but not least, Wellbeing, over to you. And I know there was one very specific question and actually some follow-up comments there about Thailand and the kind of challenges that Thailand has faced implementing some of its multisectoral collaborations. Would you like to take that?
Yes, Sarah, but before the question, the sharing of Thailand, may I add on some approaches for promoting multisectoral collaboration. For example, in Thailand, we have a National Health Assembly where we get opinions from many constituencies. This is to promote the bottom-up approach for policy design and also the agenda setting of the policy. It could be any public policy related to health. For example, garbage, how to manage garbage or waste in the community. That is also very related to health of the population in the community. I would like to refer to the question on challenges facing in Thailand. It depends on issue. For example, if it is on research, Charles mentioned about the AMR, antimicrobial drug resistant. In Thailand, we have also the working team for the AMR, monitoring and evaluation. We try to set up surveillance on antimicrobial consumption. This involves researchers from many sectors, especially from health and agriculture, from animals and also environment sectors as well. And also not only health staff, but we also need to involve in laboratory, as well as to involve with pharmacists, veterinarian, medical doctor. This variety of multidiscipline need to come and work together. The most challenges is trust among themselves. It is not easy to build trust among them, but once it is built, it could be last long by maintain and sustain trust. Trust will facilitate the further work among the group. That is one issue. The example on the research issue. If we need to have a big reform, for example, universal health coverage reform of health financing, we also have challenges in all the process, starting from the agenda setting and also the policy formulation. Implementation is also difficult, not easy to get everyone understand the same thing, and also have trust in the policy. And also the monitoring and evaluation. There are so variety of challenge questions during all the track of the policy reform. I stop from now on and return back to you. Perhaps you may have some further other questions, Sarah.
Thank you very much indeed, Wellaiporn. There are some more questions. They're kind of connected questions, but I would also just take this opportunity to encourage participants. If you have more questions, this may be your last opportunity. I'm not sure whether we'll come round with a further round of panel discussions. So please do put them into the chat box now. But the questions which are there, I think, sort of started with an original question from Tawfiq, which was really getting at this notion of accountability, suggesting that what's really important in terms of making multisectoral action work is having accountability for what different actors have committed to doing. And so Tawfiq was interested in hearing the presenter's thoughts on how do we make stakeholders within sort of multisectoral collaborations more accountable. And there's been some additional thought along those lines. And Joanna, for example, is asking, and how, given the fact that multisectoral collaborations engage actors in different types of sectors, and as we said before, not just functional sectors, but public, private, civil society, how do we hold people accountable when they're working under such different sort of legal standings, have such different stakeholders in their whom they're accountable to? So that's a tricky set of issues there, I think. Is anyone willing to kick off a conversation about that? Just unmute yourself and jump in if you're ready to take it.
Well, one thing I will say, just from a research perspective again, not that I have the answers to this question, is that a related topic that has come up and has been identified from the research perspective is that when multiple different partners are coming together in a multisectoral collaboration, it can be the case that there are very different assumptions and expectations about what progress looks like and what success looks like. The way that, even what constitutes evidence of success or progress, whether that's some sort of more of a qualitative thing, like we're hearing positive feedback from constituents, or we're seeing that we're improving in these particular indicators that are important to us and that we like to measure. So I would say one element of accountability would be making sure that at the outset of multisectoral collaboration, there's discussion about specifically what success looks like, and make sure that the measures that are identified are acceptable. There's been some writing about situations in which each of the partners actually continue to focus on their own indicators or measures of success, and which makes it difficult then to ensure that each of them are contributing to what they've agreed on as a shared outcome. So I'll stop there.
Doug, as you were talking, Anne Wilson typed in another question, which I think you may be well placed to respond to. She's asking, is someone working on, or are there plans to pull together all the different research methods, approaches, and conceptual frameworks in multisectoral collaboration, or is there still a gap going forward?
I think it is a gap, definitely. One of the things that came up at the Health Systems Research Symposium in Liverpool from October 8 to 12 was that there is a big need to figure out what are all these methods. First of all, what are the main kinds of questions that people want to answer, researchers and policymakers, which is sort of what this paper is about. But then also, which types of methods have people used and have found useful in answering those kinds of questions. So that's actually a paper that we're currently working on with a group of people who were part of the Health Systems Research Symposium to try to pull together, at least at an early step, the types of methods that have been used to answer the key questions identified from this paper. So we're planning on submitting that to the upcoming December 20th submission deadline for a special issue of the Health Policy and Planning Journal on SDGs. So I guess the short answer is I think it is definitely something that's needed. There may be other efforts that are ongoing or about to happen with respect to that, but it's definitely not something that is widely out there right now.
Thanks, Doug. And I think it's probably self-evident, but that I should perhaps say that paper clearly won't plug all of the holes that I think we're seeing in terms of research methods and approaches and conceptual frameworks. We also, actually building on some of the discussions at the Global Symposium, were thinking about starting a listserv for researchers interested in this area. So maybe I should at some point type in Doug and my email addresses if anyone's interested in participating in that. But let me go back to Charles and Wallaiporn and ask you about this question on accountability and if you have any reflections on it. Wallaiporn, would you like to say anything?
Yes, for the accountability, I'm thinking that if we now, as Doug mentioned about the SDG, I give example of the SDG 3.8 on UHC. When we did the policy on UHC, we need to translate the policy to belong to the people, not to belong to health minister or a political party who did the campaign for the UHC policy. Once it belongs to the people, it will be protected and have immunity protected by the people as well. So the accountability framework of those who are working on UHC policy need to be accountable to the people. In addition, the people have to accountable to pay tax. That is the finance for the UHC. And then the accountability framework will link directly to the aim or the goals of the policy. That is my reflection. Thank you, Sarah.
Thank you very much indeed, Wallaiporn. And over to you, Charles, for perhaps the last word here.
Thank you very much. I keep saying that accountability is everyone's responsibility. There's mention of the SDG 3 here, but we know that there are a number of SDGs that are linked to health, and all of those have their indicators. And if all of us were to follow, to play our part in fulfilling our indicators, I'm sure we would not be where we are at present. Give an example of Malawi. We have what is called a community health strategy, and in there it specifies various roles members can play, and we set various targets. So if indeed we were all set to fulfill our targets, then naturally all the building blocks would fall in place. And for multi-sector collaborations, if you're looking at, for example, I did mention one on the on hygiene and sanitation. If the water team were looking at their indicators, making sure they achieve them, or their targets and they achieve them, us in the health sector are looking at our targets and to achieve them, and the guys in the environment do the same. At the end of the day, you find that we'll be able to achieve our 2030 agenda. So let's see how we can work together to succeed. Thank you.
Thank you very much, Charles. And I think that was an optimistic sort of final note to end on about how we can really work better together to achieve the SDGs. Inam's just put in a comment into the chat box about issues around local power structures and how power can affect accountability as well as multisectoral collaborations. And I know that that's an area of interest to some of the folks on the call, sort of trying to understand relative power within this space of multisectoral collaboration. As we're moving towards 1:30 I would like to try and wrap up this conversation. I think there may be a few more slides left in the slide deck, and I'm intrigued to see what they say. I know that Jeff was trying to advertise something else coming up. Maybe we can just flick through them, Doug, so that I can...
Before you move to Jeff,
Yes.
I know you did talk about power, but we need to reduce the inequitable distribution of power, money, and resources. So it has to be not just power, but there has to be money and resources as well. Thank you.
Thank you. Those things are often very closely connected, Charles. So you're right. So we've had the participant responses and discussions. Thank yous. Was there anything else that was going to go in here? No, I don't think so. So I had wanted to do thank yous, but maybe before I move to that, my sense of this conversation is that for many of the questions that participants are raising, that policymakers are raising, we really don't have the answers yet. And I think that really reflects the state of research within this domain. My sense, and I think Doug would share this based upon the sort of overview of reviews that we did, was that it's really wide open. We have lots of case studies, and frequently those case studies are specific to a particular health problem. So, case studies of how do we get people to work together effectively, multisectorally, for HIV/AIDS, or for nutrition, or for early childhood development. But as Doug was reflecting, I think often those are very descriptive case studies that lack clear conceptual frameworks, and often sort of lack measurement, as well as more better developed research approaches to understanding what's really going on, to addressing imbalances of power, as Charles was just talking about, and this came up from Inam's comment, or we have a lack of research studies that are perhaps bringing in frameworks from public administration or other disciplines that have really thought more about this challenge of how do you get diverse actors to work together. And as a consequence, there are big gaps in terms of what we know around effective leadership for multisectoral collaboration. How do we govern these kind of collaborations and hold different actors accountable? What are the kind of bureaucratic mechanisms we should be using? So to a certain extent, multisectoral collaboration has not really existed as a research domain within the health sector field. We've had people coming at it from very different angles, from a lens of nutrition, for example, or a lens of HIV/AIDS or non-communicable disease. But it seems to me rare that we've focused on multisectoral collaboration per se in our work. So I'm hoping that going forward, this not just this webinar, obviously, but the webinar, the papers, and the dialogue, which I really think are beginning to build now, will have lead to growth of this field, and obviously a growth of our understanding, and hopefully better practices and better impacts on people's health. So thank you in particular to our panelists, to Doug for presenting an overview of the paper, which I think really helped stimulate thinking, and particularly to Dr. Mwansambo and to Dr. Walaiporn for joining us and giving their really important insights from a country level, which I think sort of helped anchor the conversation. And last but not least, well, not quite last, but I'd really like to thank all of the participants for some really excellent questions, which I think in and of themselves help take this debate further forward. And finally, thanks to Jeff Nezovich at the Alliance, and more broadly the Alliance overall, for not only hosting this webinar, but funding this piece of research. It's been a pleasure to engage with the Alliance, but also with this particular agenda. Thank you all very much indeed. I wish you the best of the rest of the day.
Thank you very much.
The webinar next Tuesday on social protection, which will take a similar format to this one. There. Thank you, Doug, for putting that one up. Thank you, Charles. Thank you, Walaiporn, and thank you, everyone else.
Thank you very much. Have a good afternoon and good morning to some of you. Bye-bye.
Thank you. Bye-bye.